Historically, into traditional medical records, people would hide information. As a physician, they didn't want their patients to know what their blood work looked like. But in our space, it's really important that the anchor points come in, right? So I see that blood work, it connects the dots to how I feel, and it becomes the motivation to then getting on that journey to improvement. And that is why it's so critical that we actually surface the data and that they understand the data, so that they're connecting the dots with the recommendations the practitioner is making as they kind of travel through that, 3, 6, or 12-month journey.
I'm Riley Reese. This is the Sofia Unfiltered Podcast, where we bring together thought leaders, wellness entrepreneurs, makers, and emerging health leaders. We're here to have raw, unfiltered conversations because sharing your stories has the power to change lives, help others heal, and transform the way we take care of ourselves. Here we go. Hi, everyone, and welcome back to another episode of Sofia Unfiltered. I'm your host, Riley Reese, and today we're sitting down talking to Jeremy Malecha. He's the CEO of Biocanic, a platform built to help practitioners manage their clients. We're going to dive in on the future of health intelligence and how practitioners are really the key to transforming our health industry here in the United States. Jeremy, welcome to the show.
Awesome. Thanks for having me. Where would you like to get started?
Yeah, for our listeners who may not know you yet or may not be familiar with Biocanic, can you tell us a little bit about your background?
So my background's biomedical engineering. So I've been in the traditional healthcare industry for over 20 years. So most of my career was actually around machine learning before it was a buzzword on a medical device. And then I got into medical records, and I spent most of my career at ResMed, where I led their connected devices initiative. So all of the CPAP or sleep apnea devices are all connected to the cloud. And so that was kind of my crowning achievement at ResMed as we kind of built that out. We ended up acquiring a number of other medical record systems. So one of the things that happened along the way was my personal health started to decline, right? So mid to late 30s, typical kind of thought I was doing everything right, working out all the time, juice cleanses, sober months, whatever. But objectively, every single marker of my health is going in the wrong direction. And I actually hit a peak weight of 240 pounds, which I jokingly call the worst day of my life. And that was kind of the turning point for me, which was my wife being a practitioner. We were doing stuff, but it wasn't really what was right for me. And so for me, my particular issue happened to be estrogen dominance. I would have presented like I was low T. So, if I would have gone on one of those online, direct consumer companies and taken testosterone, I would have actually gone really the wrong direction. And so that really inspired us to found Biocanic, which is a health intelligence platform. So the big difference about what we do versus the other systems out there is we're actually pulling all of the data together into a single view for the individual. And I jokingly say, the challenge I had with being in a functional health program was I had intake forms in Excel. I had a bunch of PDF documents of my lab tests. I had a Word document with my supplements. I'm tracking my health with an Aura and a spreadsheet. And it was really disjointed and challenging. And so what we saw was that, based upon my experience in the other parts of the healthcare industry, the technology needed to be built for the delivery model, right? And so what we saw was a lot of practitioners using traditional practice management or EMR models, but those models are really built for fee-for-service care, right? So episodic care or, this for that type of approach. It was never really built for a long-term health improvement program. And so we always, we kind of not a lot of practitioners recognize this, but we jokingly call it death by 5-minute paper cuts, right? So if you're in a traditional, organizational system, you have to open one lab, open the second lab, open the third lab, get to the right page. Then you have to go to your intake form, your scored self-assessment, and you have to look back. All of those things add up. And right, when you're relatively new and you have 1 or 2 clients, not a big deal. But now you have 10 clients a day or, 20 active clients a week. That time inefficiency is what prevents people from from scaling up, but also burning out, right? Because that time generally happens at night or early in the morning. And that's really the struggle where we see with practitioners. And so our goal from a technology solution and through our health intelligence system is to streamline and allow practitioners freedom of time to either scale or even, just get time back in their lives.
I think that's amazing that you're talking about this from the practitioner lens, right? You're that guy on the engineering side, but what I hear from this on the consumer side, I'm having the same problems, right? I have to, just like you mentioned, right? I get my data from all these different sources and, I want to put that information together, right? Before Sofia Health was what it is today, that's what we wanted to do is how do we take all these different Fitbits and wearables and how do we put this information, forget the practitioner, I needed to help me. What is this telling me? Like you mentioned, you looked at a scale and you're like, oh, I'm at 240. And maybe those lab tests online wouldn't have helped a lot, but putting the power in patients' hands is huge, right? So to be able to biocanic. So how does this help the clients?
Yeah.
Is this like a 3D holographic? Like what? It's like such an amazing benefit from the practitioner. Sure, they get their time back, but it sounds like this is doing wonders for their clients.
Yeah. And that's the other key side of this, right? Is in our health and wellness space, it is a consumer directed world, right? So traditional healthcare, you get an insurance contract, people show up on your door, you don't really have to worry about the client experience. In this case, somebody's investing hundreds to thousands of dollars in the programs that our practitioners are delivering, and they need to be able to kind of see where they're at along their individual health journey. And everybody's health journey is going to be different. So a lot of what we do, and I always tell the story, which was, I think it was early on, and my wife was recommending a particular digestive enzyme, and I was like, why in the heck am I taking this $70 supplement? I don't even know if it's working, right? And she goes, oh, don't you remember on page 3 of your microbiome test, you have such and such overgrowth and dysbiosis. And I was like, I don't even know which test that was.
Exactly.
To even connect the dots.
No, I don't. Is that on a printed piece of paper somewhere on the bottom of my floor of the car somewhere? No, I don't. Thank you.
Yeah. And so one of the things that we found, and I remember when I was leaving my corporate job, I remember the COO saying, oh yeah, my wife went to a functional practitioner and she got a 14-page Word document of all the stuff they need to do. And she did exactly 0, right? Because it was too overwhelming. And so what we solve for on the client experience side is surfacing the insights to the individual, right? So you don't need to look through all 14 pages of the advanced hormone test. You can see what's out of range. Hey, cortisol's out of whack, or, estrogen dominant, we've got some gut dysbiosis. And that's why the recommendations come together in a way that makes sense for the individual client. So they don't need to be overwhelmed. They don't need to know everything on every single report. It's really about connecting the dots. And that's kind of why our icon is connected dots, is helping that individual. We do a lot of things like self-reported reminders and trackers. So if you're trying to think about connecting the dots between sessions, you want to give that feedback. So you could do something like, hey, if we're working on morning energy level, set a reminder saying, what's your energy this morning? And then ask about the behaviors from the night before, right? And so it gives the individual saying, yes, I got off electronics by 10. I avoided alcohol. I wasn't using phone. I used my blue blockers. And now they start to learn when their energy is really good in the morning based on the behaviors they implemented the night before. And those are the types of things that just can't be done in the other systems that we really wanted to think thoughtfully about in order to really help that individual learn what those behaviors are and how to actually maintain their health journey.
Yeah, so that's really incredible. I guess, what I hear from this is like being able to put the power back on the consumer side. And do we have to go through practitioners to get this? I mean, as an individual, can I just download Biocanic and put my own data in and then connect all the pieces that I'm tracking to proactively maintain my health, or do I have to go to practitioner?
So we actually don't go direct to consumer, and it's a very specific decision there. One of the things that there are a lot of direct to consumer brands, and I'm sure anybody watching or listening to this has the same experience on Instagram. There's no less than 100 D2C brands out there that are going and selling lab testing, and they're making personalized recommendations. The reality is everybody is unique and individual. And so just having the data for the sake of data isn't really meaningful unless somebody helps you understand what to do about the data. And so that's really why we focus on practitioner enablement, because that practitioner is the one that's going to say, hey, Jeremy, you're a shift worker, or maybe you're a police officer or a fireman, so you can't do like a general sleep hygiene program. So what are the things that we can do based upon your lifestyle, your diet, your approach, that then helps us work on whatever the individual data is saying? And that just can't be done through technology yet today. maybe in the future, but it really takes that human to understand the client on the other side of the table to really determine what's the best course of action going forward.
Yeah, and I think that's a really good point, right? So obviously at Sofia Health, you can book live, but I don't know if we want to replace that, with just AI or technology. I like having that human interaction, and it's like having that, that coach or that person, like knowing that you're in good hands by a reputable source. I think that makes a really big difference. How are you helping the practitioners, right? So we know we have the client engagement, and you're bringing all these pieces together. Are you guys using the AI or machine learning? Like how are you guys using all the data to give the practitioners even more power at their fingertips? Because I'm sure you are.
Yeah. Well, so today we mainly focus on kind of the third-party integrations, which is just really leveraging those technologies to say speed up the charting process, get the 80% of the chart note, and then you can tailor and tweak it for the individual. And then also we work with some other third-party systems that do a little bit more broad-based analysis. So blood work, genetic data, environmental working group data provides you a health score and some interventions as well. The kind of the opportunity ahead of us would be to surface more insights to the individual practitioner. Like, hey, did you know clients like Jeremy who have got dysbiosis and estrogen dominance have benefited from X, Y, or Z intervention 70% of the time? That's where I think that's kind of the next level. And it's called, the term's called clinical decision support, but you're basically surfacing insights so it simplifies the practitioner. They don't need to go to their community, to PubMed, to wherever they're getting their information from, because it'll present it there in the context of the individual.
Helping drastically make things better. It makes things better and faster because, even going to your doctor, they're going to have to go research, and it just takes time. This is really, really speeding things up. Do you have any really good examples of how Biocanic has really changed lives from practitioners? And yes, we know it's speeding up their time, but also working with their clients. Do you guys have some good examples?
Yeah, so we have one practitioner. She's actually got a team behind her, and she has actually fully automated the experience from her market awareness all the way through to her program design and implementation. So what she does, online summits, to a post-summit webinar, to a 4-week or 6-week group program. So she runs one test and then a group program with everybody that enrolls. In her case, she can actually enroll 500 clients in a day. And all of that's done through the technology and the automation that we kind of focus on, which is integrating with the contact system, the conversion system to bring them in, auto assign the forms, auto order the lab, and then auto kind of build that experience out. And so that's really where like the technology can really help people scale. And so we work with a number of different practitioners in that approach as they start to think about, how do I see more clients, drive better outcomes, and do it more efficiently with less work, right? And less burnout that they're typically doing today with the kind of bouncing around between all the different systems.
Yeah, absolutely right. So a lot of the practitioners, look at these one-to-ones and they're looking at how am I going to leave my day job when I know this is how much I make on a one-to-one. And that's great. That's how much you make on a one-to-one. But then how are you going to get the client flow, and how are you going to support that on the back end to make that sustainable for you to leave your full-time job?
Yeah. And that I think is where the technology integration. So, using a platform like Sofia where the leads are coming in, they book the appointment, you're qualifying them as it's a client you want to work with, you transact with them for whatever your package price or promotion is. And then that onboarding process can be seamless behind the scenes, right? And so now you don't necessarily, as you're building your business and, thinking about leaving your full-time job, can start to run behind the scenes, and you can start to really carve out very specific hours, right? So your administrative time is very little, and you're only focusing on those one-on-ones as you build your client base. Yeah, and then, of course, having that great consumer experience, now they become your marketing engine, right? So they're having success, they had a great experience, and now they can start to drive referrals for you. And that's the gearing effect of how one can kind of move on from their day job.
Yeah, I don't think a lot of people really think about that experience level. A lot of practitioners are so focused on how am I going to get a lead? You also have to think about how are you going to deliver your service, and how are you going to stand out from the crowd, or what are you going to offer that person? Is that good customer service? Is that good technology? What does that look like with the apps and integrations? And it sounds like Biocanic is giving them a really great experience. I just want to circle back to the consumer side.
Yeah.
Does a consumer that's working with a practitioner, do they get an app, or what does that interface look like on the consumer side?
Yeah. So we're also a little bit different in that respect. So the dashboard that we build is more like a dashboard than it is a file system. That dashboard, which can include, over 10 different wearable integrations. We have over 200 different specialty labs that we process data out of, programs, diet, meal planning. All that content is delivered via a single interface. So that makes it really easy to see that. Then we do have apps where they can log in, communicate, do tracking as well. But the most important thing is that with the exception of two things, everything looks the same between the practitioner and the client, and that's done intentionally. So historically, in traditional medical records, people would hide information. As a physician, they didn't want their patients to know what their blood work looked like. But in our space, it's really important that the anchor points come in, right? So I see that blood work, it connects the dots to how I feel, and it becomes the motivation to then getting on that journey to improvement. And that is why it's so critical that we actually surface the data and that they understand the data so that they're connecting the dots with the recommendations the practitioner is making as they kind of travel through that, 3, 6, or 12-month journey.
I'm still stuck on the physicians actually hid the data. And I know you worked on EMR systems, so they actually intentionally hid pieces of data. And now you are why would they do this?
And so in the traditional healthcare space, the U.S. government is kind of changing its tune. There's now new legislation called information blocking, which is now penalizing EMRs for not exposing that information, allowing the individual to see that information. Originally, it was more of a liability. Hey, I don't want somebody going to WebMD and then showing up on my doorstep, with analyzing their blood work and their own on the online communities. But now, more than ever, we're seeing people basically want to take back control of their own health. They recognize, look, I am the only person that's going to advocate for me. I don't want to be on chronic medications, thyroid medications, whatever. I want to be able to get to the root of my issue and understand how best to address it without being on, chronic medications for whatever that is. So there's been a huge shift, like it or not. There's a bit of, the post-pandemic world, there's a lot of skepticism around the healthcare industry and whether it's truly in the, thinking about the benefit of the patient. And so now patients are really wanting to own their data, get access to data, to really understand how to make the right decisions for them as an individual.
Yeah, and I think that's nice that you guys are bringing it to the forefront. So you guys made the dashboard for the practitioner and the client super easy. Now switching over to the practitioner side, is the practitioner have, I'm assuming, one login, and then they just have the dashboard so they can flip through patients pretty easily, or clients, whichever one they're dealing with, and they can see all of their data. And I'm sure you have all the notifications.
Yep.
How are you helping them? So I know you're talking about the intake form and helping them scale their business. How are you helping them manage their clients over time, right? So, if they've got 500 clients, I'm assuming there's going to be a lot of messages back and forth. Can you talk a little bit about that automation and what you're doing for them to help them?
Yeah. So as a customer scales up, we actually do a number of different client relationship management or CRM system integrations. So if people are familiar with that term, that's products like HubSpot or Salesforce, Keep, High Level, Active Campaign. So we're very open in that respect to kind of figuring out how we can simplify and be able to kind of dashboard the individual, right? So how many of your individual clients are awaiting results for, results from the lab? How many of your clients are on an evergreen or as kind of a self-management program? How many people have not filled out their intake forms, right? And so thinking about it in some of the other systems, you have to go one by one to figure out where they're at. With our notification system and our integrations, now you can actually streamline that. So somebody fills out a form, you can tag them, move them to the next step in the process. So you're not having those constant.
So it is literally like a CRM where you're dragging people through the flow instead of us dragging through, like, how to set up your business. For us over here at Sofia Health, don't forget to set up your bank account, add your services. This is, hey, this person did their intake form, and you're literally, okay, automatic emails or notifications are going out to the user to get stuff set up. That is awesome.
Yeah. So think about, for a practitioner out there, think about all the times that you had that initial consultation and they didn't fill out their forms, right? It was a total waste of time. You could use that time with another, working with another client who did do that, right? So now the notification system will say, hey, you have an appointment coming up on Wednesday. It's Monday. You haven't filled out your intake form. If you don't fill it out, we're auto-canceling it, and we're going to move you out until you do complete that form.
Yeah, absolutely. A lot of practitioners in functional medicine need 24 or 48 hours. Well, that's what we see on our platform, right? To process all of the data. There's so much collection you have to do on these initial visits, right?
Yep. And that's one of the things where all of the effort is usually upfront. And it's so important to make sure that when they think about the program implementation, that you're getting somebody in for a longer period of time, right? Because you're investing anywhere from 6 to 8 hours per person just to understand all the data, build the plan, the approach, the conversation, the results review. And so with our system, we can bring that down by 60%, but then you can also then drive a better engagement over time. So they're following up, they're buying the 5-pack or the 10-pack of coaching, they're engaging with you, you have your supplement commissions, you have our other affiliate links as well. And that's really where you want to, once you get them in, you don't want to just have them fall off of the results review. We see a lot of people historically that's where they would get the data and they just disappear. So really being able to deliver a seamless end-to-end experience, it keeps them engaged. And that's really where the benefit comes in. So that upfront investment then gets spread out over time.
That's incredible. Okay, speaking of practitioner tools, so Biocanic is one, right? And we tell all the practitioners coming in on client engagement, we're like, Biocanic is one of these go-to places. But when we're looking at the practitioner business, right, we know we have the buckets like the business, then the sales and marketing and the client engagement. The client engagement piece, if they're coming to you and they have, like, let's say physicians, right? They're like, I have my EMR, I have this data system, this data system, this data system. What do they get to eliminate with Biocanic? Is this like, what does that look like for them when they go end to end? Because we know we have the CRMs, but it sounds like you're integrating CRM systems.
Yep.
So
we have self-scheduling. So you could use our system for self-scheduling and save not having a Calendly schedule once. We have built-in task management. So if you do use systems like Asana or ClickUp or Trello, you don't need to use that as well. We also centralize all of the billing information as well. So connect to your Stripe or your Square, that connects in as well. So you're simply invoicing directly from the client chart. You don't have to bounce around on that as well. We have legal documentation, so electronic signs. You don't need DocuSign or Adobe as well. So we kind of eliminate all of those kind of touch points all within a single experience. Just as soon as they come in, they convert, and you want to design and implement their health program, everything can be turnkey out of the gate.
And what about like the nudge and the teachables and the programs? And what about all of or other EMRs? Do they have to be like for billing and stuff like that? Do they still need their own EMR system as well?
Yeah. So we do program content, and we have similar to what you have. We have we have like a programs marketplace where they can go grab other people's content just as a jump start to get going. Then there's auto notifications that will come through. And then, so we do reminder text, outbound, both text and SMS. Yeah, there's so much there. Even we do medical e-prescribe and e-fax. The one thing we don't do is billing. So we do not do coding or reimbursement. That's where our kind of brick and mortar hybrid customers will use their existing EMR for that function. That being said, we do have practitioners that will create super real templates in our system just to provide, but they are all 100% cash-based.
Okay, got it. Yeah, so it looks like Biocanic is solving a ton of the back-end business and client engagement software. All-in-one go-to tool. I'm not sure why practitioners wouldn't incorporate that simply for the customer satisfaction alone, giving people an insight into their data.
Yeah, that ability to kind of see everything in one spot is a huge value proposition, especially when you're selling a higher ticket program. You really want to be able to kind of have that experience, whether it be a continuous glucose monitor, an Oura ring, a Whoop, a Withings alongside of that. It may not be clinically useful to the practitioner in some cases, but experientially for their clients, it kind of brings it all together to a single experience.
Yeah, I love how you're talking about the client experience, right? Because we just have shifted gears from here, do what you're told, to this is an experience for clients. And I think that's so important to put that forward. Jeremy, this has been such a fascinating episode, and it's so critical for practitioners to be delivering, at the top of their game, right, as professionals. But I really believe practitioners, like on this functional medicine, integrative, whatever you want to call it, I really believe that they are really pivotal assets to our healthcare system, right? Getting people to have access to their own care. I just think that they're really assets to the traditional healthcare system.
Yeah, absolutely. And, and for practitioners to be successful, they need to be efficient and have the ability to scale. And that's really where we come in. And our focus is how do we help practitioners deliver their program efficiently so that they can see more patients and drive better outcomes.
Yeah, you said that so well. I believe that's on your home site, on your homepage. I think that's incredible. That's exactly what you're doing. Well, we're going to tell all the practitioners in our network about it, share this with them if they haven't heard of you yet. Again, maybe one day you can be direct to consumer unless you don't want to get into that. But I agree, data, you need somebody to read your data for you. Now we have to start finding practitioners who have this kind of service if we want this from the consumer side.
Yep.
But a question that we ask all guests on the show, if you could, can you share 3 fundamental pillars that contribute to your well-being?
Yes. So one is sleep. So I used to say, I'll sleep when I'm dead. Sleep doesn't matter. And I work for a sleep apnea company. I am very prioritized for sleep. So my sleep cycle is I go to bed early. And if I need extra time of the day, I get up earlier. So I'm not working late, getting, blue light exposure, getting triggered by, emails coming in and stuff. So that's one. The second one would be my dietary approach. So anybody that goes and searches for me, I talk about my kind of individual health journey or microbiome. So I'm highly reactive to a lot of different foods. I notice a huge difference. So I'm personally reactive to beef. I don't know why. Not really sure what that approach is, but I know like my back will hurt if I go eat a burger, brisket or anything like that. So I'm very pragmatic about kind of my dietary approach because I can actually measure and see the impact just from an acuity, pain management approach. And then the other thing is the connection, is the community connection. I think one of the things, especially for practitioners that are operating virtually, is to find a community where you can still connect with somebody in person. I think it became more apparent post-pandemic, but the ability to kind of be around people, and live off the energy of other people and learning and connecting is hugely, it's not really labeled well. They call it social determinants of health, but it is critical for mental well-being to be able to have that community connection and in person as well. It can't just be done over Zoom. So I still play kickball at 47 years old.
Yeah. Get out and play kickball. That's awesome. Yeah. Well, thank you for that. I think those are excellent. And, over the course of doing this show, we are seeing the same trends and it's just pretty incredible. And I love how community or the family and those bonds are, on everybody's top of list right now.
Yeah. Awesome.
Can you tell our listeners where they can connect with you?
Yeah. So we are Biocanic, Biocanic. If you wonder where that word came from, it's basically the merger of biology and mechanics. So the concept was just like you take your car to the shop and they plug it into the computer, it's like a biology mechanic. So we're biocanic.com. Go ahead, check us out. We also have a pretty active community called the Health Intelligence Exchange. You don't have to be a customer to be a part of that. Similarly, we highlight new practitioners' approaches. Our goal with our community site at the Health Intelligence Exchange is just to elevate the collective knowledge, help practitioners learn from other practitioners about what works, what didn't work, what are the learnings and how to be successful. And then we have our live event coming up, which is HIX-Live, which is San Diego in October. And that is all about the intersection of clinical research and business application. So our goal there is just to arm practitioners with the ability to walk away, package, price, and promote their offering. You'll learn from a number of different niches, Dr. Tracy Gavin, Dr. Carrie Jones, some really interesting stuff. And, at a minimum, you should get 100 followers that will subscribe, and follow your posts to build your network, especially if you're just launching that, you're wanting to create visibility. So we're really focused on kind of helping people build their networks of their own cheerleaders.
That's awesome. Thank you so much for being here and sharing Biocanic and how you're helping transform really the health and wellness industry. We appreciate it.
Yeah, awesome. Well, thanks. I appreciate it.
Thanks so much for listening. This has been Sofia Unfiltered, a podcast by Sofia Health, the #1 marketplace for health and wellness. Find services, classes, and products from the top health and wellness providers. Book an appointment or join live classes now. I'm your host, Riley Reese. If this episode resonated with you, we'd love to hear about it in the comments section of your favorite podcast provider or with a 5-star rating. Let us know what your biggest takeaway from this episode was, or share it with someone you hope to inspire. Join us again next time for more real conversations, stories, and insights that help empower you with the knowledge and inspiration needed to transform how we care for ourselves.